right, so thank you, beautiful people, for tuning in to watch another video. Today, I will be covering strokes. I will talk about modifiable stroke risk factors, so things that you can do to actually prevent yourself from or reduce your chances of getting a stroke, or even if you've had a stroke before, that you reduce your chances of a recurrent stroke. So, what is a stroke? A stroke is an injury to the brain that occurs. There are two main mechanisms. So, either a blood clot forms inside the brain, which is called a thrombus, or a blood clot forms in the heart and travels to the brain, an embolus. This is an ischemic type of stroke. We also have another type called hemorrhagic, that is a bleeding type. That is when a blood vessel ruptures. It can happen if there is an artery and there is a weakened part of the artery, so that part becomes weak, so it breaks, it ruptures, and it bleeds. Also, another cause could be from high blood pressure. It causes the blood vessels to rupture and it bleeds. So, two types, ischemic and hemorrhagic. Now, there are some genetic factors that puts patients at risk for strokes, unfortunately, or certain conditions, autoimmune diseases, certain cancers that puts people at risk for strokes. But we will be focusing on things you can actually prevent, right? So modifiable stroke risk factors. Now, the number one cause of stroke is high blood pressure. So, I will keep saying this likely in all my videos because high blood pressure affects so many things that a lot of people don't know. And most people don't even know they have high blood pressure because they don't check it and it's something you do not feel. Okay, so make sure that you're checking your blood pressure. If you've never checked, taking your blood pressure in the past 3 months, make sure that you go check it today. Okay, now ideally we want the numbers to be in 120s over 80s. If that is between like 100 to 120s, 60s to 80s, we good. All right. Now, that's number one, high blood pressure. Number two, high cholesterol, hyperlipidemia. If your cholesterol levels are elevated, you put yourself at risk for stroke. Again, this is something you're not going to feel it. So it is very important that you see a primary care provider at least once a year to check your cholesterol. Number three, we have diabetes, elevated glucose levels. People with diabetes are also at risk for strokes if diabetes is not controlled. Now, there is smoking. It's one of the worst things you can do to yourself. And the best thing you can do to yourself is to stop smoking. If you smoke, your chances of strokes very high. Then there is alcohol. Increased alcohol, excessive alcohol use puts you at risk for stroke. So reduce your alcohol intake significantly, or better yet, just don't drink alcohol. Now, there are cardiac causes as well. So, people with atrial fibrillation, where the heart does not beat like it's supposed to, it kind of quivers. It also puts patient at risk for stroke. So when I talked about the ischemic stroke, this is one of the mechanisms where the heart beats, like it quivers, and then the blood thickens, it throws a clot, it goes to the brain, it blocks an artery, boom, there's a stroke. So again, just make sure that you go see your primary care. As if you have like a family history of heart diseases, they need to, screen you more in depth, but it's just good to have a regular heart checkup as well. Now, sleep apnea. Sleep apnea is actually a condition that, as a provider, I don't think a lot of people, the population, is educated on this because most of my patients don't know. And whenever I see them after a stroke, it's the first time they're hearing of it. Or they may even know about it, but they're like, I don't want to, wear a mask to sleep. So just so you know, sleep apnea is cessation of breath. It happens when people just stop breathing when they sleep. Okay. There are two types of sleep apnea. I'm not going to get into that in this video. But in sleep apnea, patients either stop breathing or they're not taking in a deep breath when they sleep. So there is increased blood pressure that happens. Your blood pressure goes up, it goes down, it goes up, it goes down. It puts pressure on the heart, it puts pressure on the brain. It increases stroke, especially, some people can have strokes in their sleep and they don't even know. Sleep apnea is one cause of it. So, if you snore, if you're tired during the day, if you wake up not feeling rested, regardless of getting a good amount of sleep, you wake up with headaches, you have memory issues, you're always thinking, you have this mental fogginess, any of these symptoms, you may be at risk for having sleep apnea. Mention it to your primary care provider. The good thing is you don't have to go to the hospital overnight to do a sleep study. You can actually just do it at home. So if you have any of these symptoms, and remember, you don't have to snore to have sleep apnea. If you have any of the symptoms or you're just concerned, ask your primary care provider. If you already have a neurologist, ask for a sleep study. Okay, so we talked about high blood pressure, high cholesterol, diabetes, let's say cardiac conditions, so especially like atrial fibrillations or other cardiac conditions or heart conditions that can do it as well, sleep apnea, smoking, drinking alcohol. These are things that you have a say in it. Even if it is a heart condition, you find out early, you get on medications, okay? Even if most people were like, okay, I'm going to eat better, I'm going to exercise, and I recommend all that. But if you find out you actually have these conditions right away and your like blood pressure is extremely high, cholesterol is extremely high, get on medication and exercise, eat better. Once you get to the level you want, then you slowly ease off of the medication. But it is very important that if you're prescribed a medication, you take it. Recurrent strokes, we see it if patients don't stop smoking and if they don't take their medications, okay? So I advise that you take care of yourself. You eat better, you exercise at least 4 days of the week. Let's say you sleep well, and vital sleep is important, and that also goes into sleep apnea as well. So take care of yourself, eat healthy, let's prevent strokes, spread the awareness. We will talk more about specific videos, specific conditions, I'm sorry. And if you have a topic you really want me to cover that relates to the brain, everything brain, remember, if it is in my specialty, because, there are several subspecialties when it comes to the brain, I will for sure cover it. So, till the next video, thank you for watching, beautiful people, and stay blessed.